And when our next guests, Justin and Claire, found out something was wrong with their unborn child, they hoped a breakthrough surgery would give him a chance at life.
We've always wanted more than 1 or 2 kids.
We had 2 happy, healthy children, and then we decided to have a 3rd.
It was a normal pregnancy. Then we went in for the 19-week sonogram to find out the sex of the baby, and that's when we got the news. We could tell the sonogram technician was taking a little bit longer than what we knew as normal. The doctor came in and she said, without a doubt, this is spina bifida. My reaction was shock. I had a very vague idea of what spina bifida was. He had clubbed feet and he had a herniation of his cerebellum, his brain. The longer that the baby's opening in his spine is exposed to the elements in the amniotic fluid, the more damage it does. But she did give us a glimmer of hope, and she mentioned that they can do a repair of the spina bifida before he's even born. And it's called fetal surgery and gives him a chance for more normal development. I knew that I was going to do it. The surgery was supposed to close the spine and put everything back in its place, and there were no promises. The doctors warned me that worst case scenario would be my death and baby's death. But you want to do everything that you possibly can to give your child a better life.
Well, I'm happy to say that there is a happy ending to this story. Claire made it to 35 weeks of pregnancy and gave birth to baby Kellen just 6 weeks ago. You all want to meet him?
Yeah.
Come on out.
How is baby Kellen doing now? Are you okay?
He is great. He's absolutely wonderful.
And I do want to say that also joining us is co-director of Texas Children's Fetal Center, Dr. Daryl Cass. Thank you, Dr. Cass, for also joining us.
Thank you.
And I'm so glad we get to talk about this because...
Yeah, and you had quite a team taking care of you. You're such a brave mother. But for a lot of people at home, they may not understand, how this develops. And it really starts in about the first 2 to 3 weeks of pregnancy before mothers are even aware that they're pregnant. The neural tube develops, and that's part of the central nervous system with the brain and spinal cord. And if there's a defect around there, usually can occur towards the lower back. And you can actually have exposed nerves there, and you can also be associated with swelling of the brain, which occurs with fluid collection because the cerebrospinal fluid is blocked. And sometimes you need to put a shunt in there and things like that. And a lot of times, what we've done in the past is we've done surgeries, right after baby's born, essentially. And so this is just cutting edge